Over the years, Pittsburgh has transformed from a steel manufacturing city to a community focused on being a leader in the healthcare field. At Robert Morris University, our mission is to be a leader in providing superior education and training to support this growing field. Hi, I'm Dr. Valerie Howard, Associate Professor and Director of the Regional Research and Innovation in Simulation Education Center, otherwise known as the RISE Center at Robert Morris. When I started at RMU in 2004, I was fortunate enough to work with a dean who had the vision to dedicate time, personnel, and funding toward learning and understanding simulation technology. Through simulation, healthcare providers are able to practice their skills on mannequins while in the safe environment of the simulation lab. Therefore, patients are not harmed while the trainees are learning. The mannequins are realistically programmed to respond like a real human being would in a clinical setting.
Oh, I can't breathe.
In 2005, we began using simulation in a sound educational manner based upon the best practices in education and the emerging evidence surrounding simulation training. Since then, Robert Morris has been a leader in developing high-quality simulation experiences and conducting numerous research studies to examine simulation. RMU faculty have published numerous articles to contribute to the growing body of knowledge surrounding simulation. Through the use of simulation, our healthcare providers can receive better training, which equates to better patient care.
I was doing one of my night shifts and I walked into my patient's room one night and she started to show me symptoms of left-sided facial drooping, and she wasn't able to speak with me, which was not normal for her condition. These were classic symptoms of having a stroke, and needless to say, I was very nervous. But I did a scenario in the RISE Center, and that taught me to gather data quickly, and I was able to intervene quickly and treat my patients accordingly, according to the protocols.
After receiving generous funding on both the federal and state levels, as well as Highmark Blue Cross Blue Shield, we were able to purchase additional mannequins, task trainers, administrative management software systems, and a state-of-the-art digital recording system. Also, we were able to hire and train dedicated staff and educators to assist others with this challenging technology. The equipment purchased and the dedicated staffing helped create what the RISE Center is today.
As Dean of the School of Nursing and Health Sciences, my job is to ensure that students are well prepared for the workplace once they graduate. Here at Robert Morris, we believe all students should have experiences which incorporate our 6 core values: academic excellence, professional focus, individuals matter, engaged learning, global perspectives, and changing lives. Academic excellence and having a professional focus rely on a basic principle: application of knowledge. Practice in the RISE Center helps students understand difficult concepts and increase personal confidence. This gives our students an edge when functioning in their first professional position. Providing an engaged learning environment includes simulated clinical experiences in our newly created RISE Center, with students assigned to the role of primary nurse, nursing assistant, spouse or child of a patient, or even the MD. In this activity, students practice communicating and interacting with others in preparation for real-life situations.
Right now I'm working in the intensive care unit. I had a patient present, a loving grandmother and mother, with chest pain. And I remember that I had a scenario at the RISE Center about chest pain and what interventions I need to provide and when to call the doctor and when to intervene. And I applied everything I learned to that patient. I called the doctor, I did the right interventions, gave the right medication, and she turned out great.
Our students often work in small groups and can easily schedule additional simulation time to reinforce key concepts, emphasizing that individuals matter. Our students prepare for global perspective by caring for simulated patients from all around the world, whether it is student trips to Nicaragua or traveling to China. Nursing students at RMU learn to provide culturally competent care that is without borders. The last core value is arguably our most important, changing lives. When students practice, they're immersed in the experience. Learning becomes real. Students are changed, but now they have the tools to change the lives of their patients.
The healthcare field is constantly changing and is always in need of competent nurses, doctors, and other healthcare professionals. At Robert Morris University, we believe in order to meet the needs of this industry, our students need practice. The Rise Center gives us this opportunity. We believe that simulation has the potential to reduce medical errors, enhance patient safety, and improve patient outcomes. Superior training for our healthcare providers translates to better delivery of healthcare to our patients who deserve this the most. We believe the Rise Center is just the beginning of an engaging learning experience that only Robert Morris University can offer. Our future vision is to build a state-of-the-art simulation center in order to expand our training to more healthcare providers in the region. This facility will have a critical care area and trauma bay, a maternal infant suite, several medical surgical rooms, and exam rooms to expand our standardized patient experiences. By offering cutting-edge simulation training to our present and future healthcare providers, our patients will be guaranteed to receive the highest quality of care that they so richly deserve.